A local rally against healthcare privatization as part of a province-wide day of action. Good evening and thank you for joining us. Close to 100 people attended that rally in the city today to protest against privatization in Ontario.
It's part of a province-wide movement to pressure the government into keeping healthcare services in the public system. Lee Noonan was there. She joins us in studio. Lee.
Thank you, Ryan. Protesters here are angry and disappointed with the Ford government's handling of the healthcare file, particularly since the pandemic. Many are healthcare workers themselves, some are patients, and others attended as a show of solidarity. Protesters gathered at the Service Ontario building on James Street to raise their voices against the privatization of healthcare. They say funding private services is drawing resources away from the public system and making the shortage of healthcare workers even worse.
In a perfect world, we're going to finance the system that we have enough so that you're going to attract those qualified people to the system, right? Why are we paying more to attract people outside of it instead of putting those dollars into the system that we need right now so that we can work alongside each other, side by side, making the same wage, making a fair living wage, and making sure that we can take care of our clients and our patients appropriately.
Candice Shirk represents roughly 2,000 local healthcare workers through the SEIU. She says more and more of them are leaving the field because they aren't supported enough in their roles or because their wages just aren't keeping up with the rising cost of living. Cheryl McSweeney is VP of Political Action for Ontario Nurses Association Local 73 and represents more than 1,200 local RNs. She says a lack of funding directly affects the hospital here.
It means that instead of having a full nurse complement on a shift, you might be short one or two nurses on that shift because the government isn't funding for the staff.
The rally was organized by the Thunder Bay chapter of the Ontario Health Coalition, which coordinated rallies around the province. They say the list of services the Ford government wants to privatize is growing and that across the province, patients are paying for services that should be covered under OHIP.
You talk to anybody that needs health care, there's a shortage of doctors. We've had a couple of health emergency room closures in Marathon and Red Lake. And we just see that as the beginning of more and more closures because of shortage of staff and doctors and nurses.
Aside from keeping public dollars in the public system, Tupker says they also want to see healthcare funding increase in general. According to Statistics Canada, Ontario has one of the lowest per capita rates of healthcare funding of any province. Lee Noonan, TBT News.